August meeting of the Small Business Health Options Committee. I'm Grant Ritter, the chair. I'd like to remind everybody when they speak to please identify yourself at least the first couple of times so we know whose voice is speaking and for the recording purposes. To start things off, I guess I'd like, Margot, could you call a roll?
Yes, absolutely. Also, the meeting is being recorded for minute-taking purposes, and we will also post the recording of the proceedings on the agency's website. And I'll start with the roll call. Grant Ritter.
Here.
Pamela Russick. Matt Katz.
Here.
Paul Philpott. Kevin Galvin. Ellen Skinner. Shelley Sweet. Paul Lombardo.
Here.
Christopher McKiernan.
Here.
Thank you. Have I missed anybody, any members from the committee?
Okay. Could the members of Access Health also identify themselves?
Good afternoon, James Michelle, Access Health Connecticut.
Good afternoon, John Carbone, Access Health Connecticut.
Good afternoon, Jerome Chisholm, Access Health Connecticut.
Anyone else? Okay. Then I guess next I'd like to have somebody make a motion to accept the minutes from the last meeting.
This is Matt Katz, so moved.
Thank you, Matt. Second? Maybe Chris, were you here?
Sure, I was here. Yep, I second.
Okay. Discussions or any edits or changes? If not, Margot, could you call the roll to accept the minutes from the last meeting?
Certainly. Grant Ritter.
Yes.
Pamela Russick. Matthew Katz.
Yes.
Kevin Galvin. Ellen Skinner. Shelley Sweet. Paul Philpott. And Christopher McKiernan.
Here.
Okay. We'll take that as a yes.
Yes, I'm sorry.
So I'll now turn it over to John to give an overview of the summit meeting and shop metrics that we can update.
Thanks, Grant. Again, John Carbone, Director of Small Group, Broker Support, Product Development. Good afternoon, everybody. So I know it's been a little bit since we've kind of met. So one of the big things that we've done over the past 2-3 months is we've had the Connecticut Small Business Summit. So, over the past 3 years, Connecticut small businesses have taken a major hit in their finances and their employee retention. During the pandemic, Access Health small businesses chose to reinvent ourselves. During this time, our goal was to help small businesses understand all the new programs that were being provided under the American Rescue Plan Act. Connecticut small businesses make up 99.4% of all the Connecticut businesses and employ 48.2% of all Connecticut employees. Those numbers just show you how critical and important these small businesses are to the success of our state. Access Health is here to serve as a resource, provide support however we can. And because of this, we felt it was necessary for us to be able to help our small businesses get in front of all the necessary resources they needed, to get back on their feet. So on June 13th at the Sheridan Hartford South Hotel, Access Health and Metro Hartford Alliance partnered up to deliver our first Connecticut Small Business Summit. On this day, our focus was to help small business owners, entrepreneurs, and employees. Our goal is to offer everyone an array of opportunities to discuss current trends, challenges, and small businesses face on a daily basis. And most importantly, we wanted to address them. On this day, we had over 250 attendees. An additional 140 businesses were on our waiting list. We have 25 vendor tables throughout the floor, and we're very excited to have a blend of privately owned businesses and state of Connecticut resources. We also have a number throughout the day. We wanted to make sure that we kind of touched base with many different types of topics. So we had many different types of guest speakers. We also had some individuals that came out and spoke on our behalf: the governor, lieutenant governor, state comptroller, also to the commissioner, Department of Administrative Services. Senator Lesser was also there too. You know, we were very proud to also have our guest speaker there. Her name is Gina Loreri, founder and CEO of the Statement Group. You guys may know her as the owner of the Place to Be and also Raw in our building down in our new restaurant. So we're very excited. During this kind of 6 to 8 hour day, we wanted to make sure that we touched on a variety of topics, not just about healthcare, but also about other different things. So we had 4 additional breakout sessions. One was understanding the number balance sheet management for small business. The second breakout session was walking the walk and talking the talk, marketing and community impact. Third breakout session was don't leave any money on the table, tax credits, grants, government programs. And the fourth breakout session was taking care of business and employees and health and wellness management. Each one of these breakout sessions had tables that corresponded with them, so individuals can go get this information afterwards. We also recorded the entire day. So I'd like to at this point introduce Ben Caldwell from Mints and Hope. We recorded the entire day, created a landing page. So we will dump that in the chat for you guys to see and also send it out in an email so you have it. But I'll have Ben jump in and add some additional information. Ben?
Thanks, John. And yep, Ben Cadwell from Mints and Hope. Thanks, everybody. And we could just jump to the next slide. I think John, covered the event at a high level. We found it to be, very successful. We had a great turnout, as John mentioned, between all of the attendees, the business owners, and the small business community that turned out. We had a great set of panelists and moderators and guest speakers, some of which you'll see here. Some of the shots on the left side here are just some of the pickup of coverage from Channel 8. About the event. So we definitely had some positive traction with some of the publications in the market. You'll see here some images of some of our guest speakers, including the commissioner of the DAS. There's Gina over there, and some of our panelists are included in these shots. As John mentioned, we had a number of partners that participated in that, so in this event, to make it as successful as it could be, and work with these business owners to provide the resources that they specialize in. So if we jump to the next slide, this will give you a little bit of an idea of the range of types of organizations that we partner with to make this a successful event. We had, of course, a number of state agencies, including the D. Connecticut Women's Business Development Council, the Small Business Development Center, local chambers, multiple banks, and more participating. So we had a really good turnout, both attendee-wise and partner-wise. And then we also, as John mentioned, we did record everything. We have it up on the site. We also issued a survey to all those that had registered to attend to get some good feedback. And we had some really positive feedback from those responses, as well as some feedback that I believe Matt and Pam had shared over email as well, and just additional ideas and thoughts and suggestions to continue to improve, future events. So that was really helpful. We appreciate everyone's, participation that was able to make it that day. We're looking forward to continuing to evolve this event for the future.
Thanks, Ben. So Matt, I know Matt attended and Pam, so thank you very much. Love to get a little feedback from you. We appreciate the email that you sent us with that feedback, but if you do have an opportunity to share it with the rest of the team, we'd appreciate that, Matt.
Can you hear me now?
Yes.
Am I, I'm echoing, aren't I?
A little bit.
Let me just see something. I think I'm on here twice. Give me 1 second.
While we're doing that, Ben, do you have the link that you can drop into the chat for everybody so they can take a look at all?
Yeah, let me just give me 1 moment and I'll drop it in.
I appreciate that. Thanks. We're also going through a little bit of a lessons learned phase too, because we want to make sure that we kind of improve on this for the upcoming years. And also too, we've gotten some suggestions about potentially taking this a little bit more county-wise too. So we're going to take those suggestions. Once we get everything together, we will bring it back to this team and to the advisory committee and kind of kick around a few ideas for some new concepts going forward. Thanks for posting that.
I'm going to log out and back in because I can't seem to get the microphone to work, but it was a wonderful event. A lot of engagement from the business community. The only thing I would have suggested would maybe more breakouts for social networking.
Okay. Yep. We do have that down for you. Thank you, Matt. Appreciate that. So
I'm back in. Can you hear me now?
Yep, no echo. We can hear you perfect now.
Fantastic. So it was on my end, user error. The other thing I thought worked very well was having someone from the business community talk that people knew. That was helpful. You know, maybe it's because I'm biased because I want SHOP to be successful and effective. It would have been nice to have a little more pro SHOP, you know, more of a, you know, participate, engage in SHOP. I know it was a soft touch and I appreciate that. And I think it worked well. I just would have liked to have seen a little more rah, SHOP is good, consider participating, go see so-and-so to talk about it. And again, I know that was not the effort. I mean, I did tell people to go talk to people and where to go for more information. I even pulled it up on my phone. That would be the only thing to do next time, is a little more pro ourselves. But I thought that it went very well. People were very much engaged and no one had anything negative to say that I talked to the entire morning.
We appreciate that. Thanks for the feedback, and we'll duly note that. But we also, you know, we wanted to make sure, again, you use the keyword. We wanted to have a soft touch. We wanted people to come and be able to look at and talk to people about other topics and not just be about healthcare. But we do agree with you that we should put ourselves a little bit more prominent and upfront too next time. So thanks for the advice.
So, thank you, John. Thank you for those comments. Well, Matt, that was a strategic decision that we made earlier on, that we wanted this to be more about the small businesses. Again, the thought process early on was not about health insurance. John and I had a conversation in January that I had read an article, I think it was in the Journal or the New York Times, that small businesses were struggling coming out of COVID, right? Because the funding from all the federal money were drying up. They were struggling coming out. I asked John, let's do something to give them access to resources that could help them while they are coming out of the COVID fog. That the big businesses were doing okay, but the small businesses, restaurants, and a lot of mom and pop, they were struggling coming out of it, and they didn't have the resources to turn to a consultant, to an expert to help them. So that was the intent behind creating this. It just got much bigger than we had ever anticipated, which was a good issue, a good problem to have. And thanks to Mint and Hoke and their excellent marketing efforts, it got much bigger than we had ever anticipated. But the intent was always to be about the small businesses, giving them access to resources, experts, knowledgeable people to help them. That was it. So we made a decision that let's not make this about Access Health. Let's keep it focused on the small businesses in Connecticut. But your point is well made. We discussed that afterwards. But that was a thought process we went through. It was not by accident that we didn't talk a lot about ourselves.
And I think that worked, and it was really positive. My only suggestion was just the next time.
Yep.
Now that we've already done this and brought people together once, the next time a little more self-promotion. About half the people I talked to, it was their first external kind of meeting that they'd had since COVID.
Yep.
So that was also something very interesting and positive, that they came out for this and for help. So it just highlights that people are definitely looking for something like this. And I can't say enough about the staff and the way this was structured and how everyone felt engaged. The rooms were actually perfect size. It didn't feel crowded, but it looked full. So it was really, I liked it. And I was a little late. I got stuck in right behind a bad accident, but that was my fault of leaving too late. But I really thought that from the hallways engagement
Yeah.
to the rooms to the meetings went great. Just a little bit more room for social networking for some of these people, maybe having Access Health staff breaking those out and having rooms to talk about topics for the next one. But it went great. I
Thank you.
can't say enough. I'm not criticizing because I thought it was wonderful. I just suggestions for the next time.
Yeah, I appreciate that. And one of our concerns also when you look at CBIA, when they have their conferences, it's all about CBIA, right? And we were trying to avoid that. Again, maybe we went a little bit overboard with our concern, but we were really trying to avoid this being about Access Health. God, when CBIA have the event, I'm not even sure if any vendors are there. It's all about CBIA, not about the vendors, people that the members. So we're overly sensitive to that. But next time around, we will be more strategic about make sure we strategically promote ourselves going forward. But thank you for that feedback.
Appreciate the feedback, Matt. Thank you very much. So we'll keep you guys in touch for anything coming up on what we're going to be doing and the information we get from our surveys and also our lessons learned. We'll share that at the next Shop Advisory Committee meeting. Again, if you do get an opportunity, please check out the link that Ben dropped in the chat. Each one of those breakout sessions are recorded with some additional keynote speaker information and recordings too. So don't hesitate. We already have our website up for next year, and we've already gotten 20 individuals that have signed up for next year's event. So we're really excited without even a date or a time or a place. So I guess this is a good thing and a bad thing, but we'll make it work. And we definitely are going to start planning a lot earlier, which we already have. So we're excited about next year. So thanks for all the positive feedback.
And I would say it's a bad thing you have people signing up without an event, actually. That's a very good thing.
I would say that. Not a bad thing at all.
We agree with you, Matt.
Yep. So, all right. So if anybody doesn't have any, I'd like to go over just metrics really quick. And I know Matt, you sent in a question too. And so we'd like to address that too. Again, these are extremely high level because we were going to just talk all about the summit, but I felt like it was necessary to kind of tell you where we're at right now, what's going on and what we're doing. So I did share year-over-year statistics from July 2022 to July 1st, 2023. We have had a 4% increase in our group size to 493. Our subscribers are down a little bit, not much, nothing relevant, but 1522. Currently, we have 2,379 members. We're about 1.2% increase. Our average size has dropped a little bit. This past year has been a little bit challenging, especially with having Connecticut come off the fully insured and basically say they're not going to be offering any renewals as of May 2023. So it has made it a little bit difficult for us to kind of find different options. But what we did is we reinvented ourselves once again, making sure that all our groups understand all the different types of options, which we did a couple of years ago after COVID, because we wanted to make sure that all the small businesses understood all the different options they had there, especially on the individual side, if it was a good fit for them. So just to give you guys a heads up, that's not a statistic here that we will be starting tracking going forward. Over the past year, we've written over 4,239 individuals, employees to the individual market, because we thought that was a necessary fit for them. So if they came into our door and we evaluated them as a group and then evaluated them as an individual, and if we felt like the individual market was the best fit for them, that's the direction we pushed them in, and that's the direction we went in. So we helped them enroll, walked them through the entire process, and showed them what they needed to do and how the individual market worked versus the small group market. So with that being said, we've kind of don't have the total number of groups but there has been an estimate of 741 groups, and that's based off the average size that we're getting in and what we're doing. So it's been a kind of busy for us, but what we're doing is we're trying to create any leads or anybody that comes into us. We're just trying to point them in the right direction. And if there's opportunities for individuals that is a better fit for someone in another product because they have in, New York business or something like that, we're trying to be a partner and making sure we give them the right decisions and point them in those directions. Any questions here?
No, but I'd like to congratulate you, John. That's wonderful to hear that you were taking care of that particular group of small businesses as well. It's the right coverage for the right kind of employee is what we wanted to strive for.
Absolutely. So go ahead, James.
No, Grant, and this rolls into Matt's question to us about the MIWAs that we've been discussing with the state legislature. Our focus is our core mission of lowering the uninsured and helping to address health disparities. And that, again, our position is that we're going to do what we have to do to make sure Connecticut residents have the best possible, affordable, quality health plan for themselves and their families. So when John and his team connect with a small business looking for health insurance for their employees, we say, okay, you know what? Let's analyze it. Let's say, what's the best marketplace for them? Is it the shop? Is it the individual market? Because that's gonna give them better plans, more affordable, and so forth. Or so, in some rare cases, we're not the best option for them.
Correct.
Right. So again, our goal here is to help them find the best plan for themselves and their employees that's affordable and is going to provide the best coverage for the dollars that they have. So we are looking at from a much bigger picture perspective. We're looking at our overall objective, and we are not delineating between shop and individual. And again, if one is the best, that's what we're going to guide. And that's what we've been doing since COVID started. Right. And we're going to continue to do that as well.
That's great.
John or Grant or James, this is Matt. I have a question or a
Yes,
few.
Yeah, by all means, go ahead, Matt.
Sure. First of all, I want to commend staff because I know losing Connecticut has not been easy. And at least this grid shows that you've been able to maintain or even improve the environment given that. So that's fantastic. I know there's going to probably be some fall off as you see more transition because of the Connecticut, but this is great. I really do, John. I really would like to see some grid or graph, back to James's point, showing that it's not just about shop, but it's about making sure there's the best coverage for the uninsured. And so showing how you've been able to transition people to other forms of insurance coverage, especially those that may have some sort of financial benefit to them by receiving some sort of discount or savings or support, I think is huge. So because the shop story isn't just about one size fits all, here, take it or leave it. It's about making sure the individual employer and employee in particular has coverage in their families. So anything we can do to have this kind of an enrollment chart also show how some of those people have transitioned from shop to individual and even other insurance that you guys have helped would be really, I think, an important positive selling point that we would want to also highlight externally, because I think honestly the perception out there is shop, but in reality it's part of Access Health, and it's about getting people coverage where they fit best. So I'd like to make sure that we're not just focusing on the groups we've kept with this transition of Connecticut, but the individuals for which we now have provided coverage. And it may not always be through Access Health, but I think that's a great story to tell and an important story.
Duly noted.
Absolutely. Yeah.
Agree.
Did we want to turn to Matt's question about association or
Sure.
stop loss
Sure.
or whatever? Yeah.
Absolutely. The MIWAs Matt, we had a meeting with this last Monday with the chair of the real estate and insurance committee of the
James, go
state
ahead
house.
and ask I apologize to interrupt, but some people may not know what that question was.
Right.
so
Sure. Go ahead. Go ahead.
I just thought if I could ask it, but I do appreciate this. And so I had asked yesterday, just because in going through the information, I had asked about the impact or potential impact on at least the current association health plan bill in Connecticut, and it's I was worried potential negative impact on the shop on access to coverage for employers and employees in the state of Connecticut. So I had asked James and John and Grant if there was any update on that particular issue so that we could better feel informed and also either feel comforted that it's not going to impact it or figure out a way to address it if it is, so that we make sure to maintain our robust shop and access health CT. So that was the question I asked.
Okay. So Matt, if it passed, it will have an impact. We don't know, we don't know how big of an impact, but it will have an impact certainly on our assessment, because if any dollars that leave, any premium dollars that leave the fully insured and it goes into association health plans would not be accessible to our assessment. So it would have a financial impact on Access Health. All right. But having said that, that is not the main reason why we have concerns. Our concerns are more about the quality of coverage that those who leave the fully insured market and go into the MIWAs, the association health plans, because we have no idea. It's very vague. The bill is very vague. We don't know what's going to be included in coverage, what's going to be excluded. We don't know the copay deductibles, and so we are concerned about that. And we're also concerned about whether or not these plans would have some of the same guaranteed coverage that the ACA requires that a shop has. So our concerns were along the again, going back to our core mission of making sure that Connecticut residents have access to affordable, quality health insurance coverage for their families. It makes no sense at all to sell a product that people have health insurance, but they cannot afford to use it because copay deductibles they have to meet before insurance kicks in is beyond their means. So those are the concerns that we have. There's the clarity around what those plans would look like if it does pass. And one of my suggestions was, we have several other states, about 10 or so. They have a version of MIWAs since 2018, 19. Question is, let's take a look at them. How they're working? Are they helpful? Are they high impactful? Are they one way or the other? And if, maybe even if we choose to move in this direction, let's take the good things that they're doing and ignore don't do the bad things that they're doing. So our position, let's do a study of the current plans that exchanges are put in place and see how they're working, and use that as a baseline to start developing our own strategies around MIWAs if we are going to do it. So again, big picture, our biggest concern is the quality of these plans for Connecticut residents. Number one, the history. John could speak more about this. The history of these MIWAs is that they're siphoning off the healthiest folks. This is the data. The healthiest folks, they're siphoning those off, and the people who are not so healthy get left behind. And on the fully insured market, which drives up rates for everybody. I understand the proposed bill had some parameters to protect that. Again, very vague. We don't know how it's going to play out. So that was our biggest concern, is that but at the end of the day, Matt and the rest of the committee, the biggest challenge is the cost of healthcare is going through the roof. whether it's MIWA or association health plans or stop loss or fully insured, it's becoming unaffordable for small businesses. So the issue that has to be addressed has to be the cost of healthcare. All right. So that's a whole different discussion. But I hope that gave you some context of where we are. We do not oppose. We do not. Can we all mute? There's some background noise.
I promise it's not me. Fine.
I don't know who that is. Some background noise. Okay, thank you. So again, our position is we are focused on doing what's best for Connecticut residents in terms that they should have access to affordable, quality health insurance. That's Matt. That's our official position, and that. It's always been that. It's never going to change. And any bill anything that's introduced in the legislature that's going to put that at risk, we're going to comment on that. Am I the only one hearing that? Okay.
Well, I'm hearing it too. So
Okay.
I think that's good, James. I just want to be clear. You presented that to the committee chairs. Was there any response from them or any agreement that they understood the concerns?
No, I made my concerns known because there was a meeting last Tuesday, and we did submit a document during the last session outlining some of our concerns. We weren't for or against the bill. We just saying, hey, if you're going to do this bill, these are the concerns that we have, potential impact to Connecticut residents, and the committee took exception to those. So we had a meeting last Monday, not yesterday, Monday before last, to it turned out to be a public hearing on Access Health to explain to the committee members. So we explained our position, and what I just said to you, I made that. I said the same thing to the. It wasn't just. It was committee chairs, the committee chair and some members of her committee, as CID was there. So was some representative from the House. Franklin was there representing the House, and also someone from the Senate Republicans was there. So it was a conversation discussion. In your note to us, you indicated that there might be a special session in September.
Yeah.
We had heard the same thing. We don't know if that's going to happen or not, but we heard the same thing. So stay tuned.
Thank you. Thank you for the update. I think Christopher has a question. His hand is raised.
Yes.
Yeah, go ahead.
Everybody, I have to sign off. So sorry, but I have to sign off here.
Okay.
All right. Thank you.
All right. Thank you.
Take care.
Right.
James, do you think, and this is Matt again, for the record, do you think we could have a copy of what Access Health said to the committee originally, or if that's outdated, something that just summarizes the positions you outlined, James?
No,
so that
we can send it. We can send it to you. It's a public document. John, can you get that to the whole committee?
Absolutely. I'll get it to Margot to get to the whole committee.
Okay.
I think that's just helpful so that everyone's on the same page. I think I may have also mentioned, James, that I got solicited about opinions on this, either because of what I do or who I know. And I told everyone they have to contact you or Grant for any comments that Access Health had. But it may be good as a refresher, given these issues, to maybe make sure people know that process so we can direct people to the right people for either comment or no comment.
I appreciate that. I know people are going to shop for they're going to shop for the right comments. So I would suggest that. And if you get any questions about the Access Health's position in the association health plan, please direct them to me or Susan Richby.
And I'm sorry, I think I directed them to you and Grant.
That's fine.
Yeah, that was the same thing. But I felt it was, it wasn't appropriate for any of us to, or at least myself, to comment, but I wanted to make sure that they had someone to access from Access Health if they were truly looking for an official comment.
Thank you very much. I appreciate that. Maybe we send a note out to the committee reminding them if they get if any overtures are made to them about Access Health small businesses position with respect to association, please direct them to to Kathy. Actually, we'll put the names on the email of who the contact person is, right? Because this Matt and his committee, we track all of the questions that come in. We have one person that gets them, we document them, and we respond very quickly. That way, we have a record who sent it in, when it came in, and when the response went out.
I appreciate that, James. And again,
Yep.
I was trying to make sure to keep it the right direction, if anything. So, and I
So keep it
appreciate
consistent.
the update. And
Mm.
I think it's important to recognize the problems that do exist with these plans is that lack of actual guaranteed access to certain services, as well as enforcement. There doesn't seem to be any enforcement, and that should be a concern too, whether it's the Department of Insurance or Access Health. For these plans, there doesn't seem to be any or very little protection for the individuals who take on that insurance. I feel that with, and again, our small part is the shop, but with shop, if someone has a problem, they go to you guys. You can either resolve it, or you send it on to the insurance department or the healthcare advocate. Someone gets involved, and I don't know who that would be in this other model. And there are benefits, don't get me wrong, of association plans that could benefit certain individuals, but it also doesn't identify service.
Yeah, look, Matt, you're making our point. This is precisely our concern. We're not saying they're good or bad. We're just saying that we don't know, because the way the bill is written is vague. We don't know. We don't know what's going to happen, how it's going to happen, when it's going to happen. That's our only concern. Again, to comment one way or the other, we need more information, more detail.
I agree. Thank you very much for the discussion.
All right.
Okay,
James.
is that it, John?
Nope, we've got 2 more quick slides. I'll run through them really
all right.
fast.
Okay. Right.
Just
Good.
again, where our membership is currently right now, as you guys know, our membership is usually always in that Beltline, Fairfield, New Haven, and Hartford. But Matt, bringing up that great point of all our individuals that we've moved over on the other side, I'd love to layer this on with those statistics. I think it may show a different number for Litchfield, Tottenham, Wyndham, New London, and Middlesex, because I have a feeling that those may be the businesses that we pushed over to the individual side. So on the next deck, we will make sure that we break that out that way also. And I think it may tell a different story. So thank you for that suggestion. Also too, next slide, I'll be very quick with this. As you guys know, going down to one carrier year over year, January to July right now. Our membership back in January 2022, 63% of it was enrolled. As we continue to go through all the renewals, trying to move business to Anthem or to the individual side or to the appropriate carrier, that now is tremendously flipped to 72% enrolled into Anthem. 28% of our business is still left in Connecticut until next May. We are aggressively trying to figure out if we should be moving that business now, looking at where the rates are and seeing what the best options are for those remaining 28% going into 2024. So stay tuned on that. And we'll have some more information and some more detailed data for demographics and membership. So thank you very much. And thank you for the great conversation. Grant, that's it.
Any questions from anybody? Okay, great meeting. If we would, I'd like to have a motion to adjourn.
So move. This is Matt.
Matt, okay. Can I second that? I don't think we have anybody else now. Chris is left.
Sure, I guess. Yes.
All right. Can we have a roll call?
Certainly. Grant Ritter,
Yes.
Pamela Russick, Matthew Katz,
Yes.
Kevin Galvin, Ellen Skinner, Shelley Sweet, Paul Philpott, Christopher McKiernan.
Okay, we are adjourned, and thanks everybody for attending, and good meeting, John.
Thank you
Thanks,
all.
everybody.
Very good.
Thank you all.
Appreciate
Thank you all.
Thank you.
Bye-bye.
Bye now.